Morning. So, in our endeavor to learn nosodes, today we have another wonderful nosodes which represents the extremist light, the light which which is stretched from the one end to the other end. So, extremist. We call these medicines to be the extremist, and this medicine is no other than Medorhinum. This was the history of the mankind uh, suffers that there are the two great disorders, disease, which the mankind has suffered, was the syphilis and the gonorrhea. And the entire distortion of the mankind were degenerated and started degenerated with the uh, degenerative medicines uh, like that of the syphilis. And Cyprinum is from the syphilis pus and Medorhinum is from the gonorrheal pus. And both are have been inflicted because of the great lustful life that the people used to spend and life, the modernity, the effect of the modernity in more attracted to other sexuality and exposure and obscene life. This is the important things that these medicines carry. So let us see these medicines today in details. So I call these medicines to be the dual dual extremist. Means it stretches at the two ends. You have seen the candle which burns at the one end, but this medicines is that type of the candle which burns at the both ends. That I used to say about this medicine, burning at the two every time. They want the life and they also destroy the life. So they want everything. The passion is more important for them, and the life and enjoyment is more important for them. These medicines, they are the type of the people who knows no boundary, no religion, no nothing. They are just the man without the boundaries, the mind without the boundaries. Is important thing that we can think about medicine. And it was the discovery, sorry, it was the Constantine Herring who made first suggestion that gonorrheal discharge could be used for as a medicine in 1833. And in the same year, Dr. Kahneman used it to use a remedy he called Frank's Tripson, which was the nosodes made from French gonorrhea. So both this is the nomenclature Medorhinum and the nomenclature of Francis triple ison, which was isolated by Dr. Henneman, they suggest the same name, but the two different names are there. The nosodes are proven by Swan and studied by a number of homeopaths in the UK. Then there are several writings available by the authors like HCLN, Rendell, CHLN, Finch, Norton, Post, Farrington, Leviton, Laura Morgan, Berridge, Wilder, Higgs, Ostrom, Nicholas, Peace, Fire, Carr, and Bigler. They were the noted persons who tried to. And the symptoms, because it is now age-old medicines, so all the symptoms medicines have been proven and clinically confirmed. The name clinicum was given by the Burnett. Now this name, as I suggested the name Medorhinum, you should also keep in mind at some places in the literature you may find this name clinicum, this medicines to be indicated as clinicum. And in the initial literature by Dr. Henneman, you can find the name Pence triple isomorph. So let us see further. And Medorhinum is obtained from the purulent urethral secretions, the secretions that is first type which comes out from the urethra, that is secret. And discharges were taken during the discharge from patients who are otherwise healthy and have not been treated by antibiotics or sulfur. Usually, for the person who gets inflicted with the gonorrhea, they start treatment with the antibiotics or the sulfur. Usually they have a lot of pain, lot of the sufferings are there. So immediately they start go to the physician and they start get the treatment and they only medicines that was used there was the antibiotic and sulfamide. The presence of now this is the name of the gonorrhea, Neisseria gonorrhoeae, is confirmed by microscope and gram test. The nosode stock is a natural, complex, not in simple laboratory culture gonococcus, and it is prepared from the lysate obtained without addition of antiseptic from fraudulent urethral discharge of the blenorrhea of several patients during the discharge. So you have to feel that what type, whether the patient was treated earlier or not, that this is important for this. And potencies were made from the uh, gonorrheal preparations are two preparations. The acute and chronic stage from the virus of acute stage to the chronic or glitch stage. Glitch stage means continuously discharging of which are supposed to contain the gonococcus. The symptoms produced by the virus in acute case have been included in the pathogenesis, such as the toxic symptoms of arsenic, mercurius, opium, and so you just this is the from what type of the symptoms are collected and put into your Materia Medica. The potentizations of the virus have been developed, latent dynamic force, which is just an effective in homeopathic practice prescribed strictly on the symptomatological basis and any other basis. Now, in our practice nowadays, Medorhinum is indicated frequently, but while prescribing Medorhinum, and or the Nosodes, people used to say they are prescribing only with the history of that. This is not good. Any medicines, whether it is Nosodes or any other sources, they have to be prescribed basically through the totality of the symptoms. This is the cream resource. The nomenclature, so many names as I told you, it is known as the Medorhinum, main name, and other names are Glenicum, Gonorrhea nosodes, Micrococcus gonai, Neisseria gonorrhea, Ether, Trypanosodes, and it group is the nosodes and it belongs to the Neisseria family. Now, Medorhinum represents the heart of the psychotic mind. As you know, Dr. Henneman's mathematical classification. So at one end there is the sora, and at the other end there is the citrus. In between, it is the psychotic mind. Initiation of the disease, which gets started flourishing during the stage that is the psychotic. So, Medorhinum represents the flourishing stage of the disease, where disease starts growing and growing and growing. And syphilis represents where the disease is now declining and decaying and degeneration. So the main feelings of the psychotic mind that I am okay as long as my weakness is covered. And in spite of so many problems, they don't have the problem. They only see that my problem is weakness. I am not a better doctor. But what is the problem? No, there is no problem, but I don't feel better. I know my weakness is not fatal. They say, but it is not an end. And because if I tell anybody, they will criticize. You are you are a so strong man. You are so built up man. And why you are killing me? So they used to hide their problem. Therefore, I must do all I can see that this weakness is not exposed. Exposed. I have been overactive in the opposite directions as the result. Medorhinum, one of the most important nosodes and constitutional nature of the gonorrhea poison has been within the recent year has been recognized in the old schools as well as the new schools. Margaret of New York and Agnes MacDonald in this country pointed out the casual connections between postpartum pelvic cellulitis and latent gonorrhea in the husband. McDonnell published several pattern cases. The effects of poison, constitutional or acute, may be taken as data for homeopathic prescription, but the virus had an extensive proving in potency and the symptoms are recorded, have been largely verified in the practice. The nosodes may be used according to the indications in exactly same way that other homeopathy. As I told you that not merely on the manifestation that patient is choleric, so I should prescribe the Medorhinum. Patient is psychotic, so I should prescribe the Medorhinum. No, this is not the theme. They have to be prescribed according to the symptoms totality. And what is the importance by knowing the nosodes? They only indicate that what are the sources from where where this problem are coming. So as I told you, whenever you are considering the chronic disease or any type of the disease which linger for a longer time, you must know, you must have to find out what are the background, what are the positive factors. So this is the utility of the chronic miasma. Kent emphasized that nosodes being constitutionally deep acting and deep seated remedies are to be used with utmost care when indicated well selected remedies fails to act. Used in frequent dosages and higher potency. Now, why Dr. Kent said that it is deep seated remedy? Why? What is the meaning of deep seated remedy? The deep seated remedy are those medicines which has got which represents the causative factors. If you know the causative factors, you have to say there are the underlying background which is holding the disease there. Some some something something inside the body they are trying to hold the disease inside them. So this is the understanding that we should understand about the deep-seated acting medicine. There are superficial medicines. That means there is no background like that of the acute disease and they can be treated by any of the medicines and no positive factors. It can be only on the symptoms totality. But when you are seeing the nosodes means and nosodes usually represents the deep acting constitutional representations. Medorhinum is a powerful and deep acting nosodes used often in aliments due to suppressed gonorrhea, and Dr. Swan introduced this nosodes in 1870. It is made from the gonorrheal discharge. So several other I am mentioning about the Burnett, I am mentioning about the many of the persons who try to introduce in their own way. Now this is the inherited miasma, inherited psychosis. Suppose if a child is got inherited, there are two types of the psychosis, that is inflicted psychosis and inflicted, that is the inherited psychosis. So inherited psychosis, the child is merismatic, merismus, asthmatic, then catral and nose, constantly nose and so tendency to cold discharge, then cauldron, frequent IBS type of the persons, and then ringworm and scalps. So not the scabies, but the ringworm or the eczematous conditions right from the birth, the psoriasis right from the birth, you can say that these persons are psychotic. And the mind are the cannot remember the names. This is one of the important things, forgetfulness. Perspire easily. Then anticipation is one of the greatest problem for the every time they are so much full of desire, so many things desire, and they always fear from the failure. So expectations are very important for this medicine. So they are anticipatory medicine. And time pressure, time passes too slowly. So they want everything to be done fast. Thinking on the and always comes thinking on the count. So this is the cycle. As in the source materialism strips of the psychotic background and confuse the practitioner more if given in early cases. Always there should be clear indications for prescribing. Now, always there should be clear indications for this. As a remedy itself on simillimum or as an organ support. Organ is supporting. That is the duty for using the whenever the organ is supporting the disease to flourish, there is a sufficient what you say manure for the plant to grow. That is the things. Failure of indicated remedy to open up a case, relapse of the indicated remedy when you have selected remedy very well. That means that you are missing something else, and that missing can be fulfilled with the use of the resource. Never well being things. After the vaccinations, after the subgonorrheal discharge, after the typhoid, after the fever, the patient was never well, never well. So it is an intercurrent prescriptions can be prescribed in that way. Medorhinum has a wealth of the mental symptoms. So many mental symptoms. Strange clairvoyance. They foresee something, curious confusion of the time sense. They always forget the dates, they forget the time, and keep on asking other people to what is the time. Loss of the thoughts, difficulty in making the right statement. They have the things in the idea in the mind, but exposition is very bad, not well. It starts well, but does not know how to finish it. So when you can see a leader, they are talking, and then they forget what they were talking. This is fear at her from behind the future. So these are the things that people are living in a dream, and because it is only because of the anticipations. Great hurry, always in a hurry. So that it is that. Cross by day and merry by night. They are always happy, irritable during the daytime, and they enjoy the night because night is the time for the entertainment. Medorhinum is a remedy which is predominantly indicated in the people who are very comfortable at night. They are happy, exhilarated, and excited as soon as the evening sets in. Fear of being exposed, and that's why they have the problem. They feel, but they don't express the anxiety. So fear and anxiety. The patient is person is clairvoyant. Clairvoyant is all type of the patients who are anticipatory nature. Sure, something has happened. There must be there. So this is the idea about which they don't know. So and mostly they are there may be some accident, there may be something, there may be. So this is the ill misfortune. He has a presentiment that I'm going to die. The person is going to die. Immediately, the minute that even something happens in the family, now the patient is going to die. So this is presentiment. It is internal feeling and external sensation inside. He prophesies disagreeable events. Something is going to, so he forecasts. He tends to absorb in his own thoughts and become absent-minded. Therefore, we find the simile of Medorhinum, the symptom, loss of thread of the conversation. They are talking, but they, in between they forget what they are talking. So, neediness, they are very mean type of the persons, high energy, and they are something, they are selfish type of the person. Skipping match, fighting, impatient, and irritability only because they fear. So they are rude type of the person, selfish. I told you, they are not. They don't think about the other. They only think about themselves. Manipulative to achieve one own end. Only for me, for me, for me is the important thing for them. Possessiveness. This is my. This is my. This is my. You can see a children in the family, 4 or 5 children are there, and they feel that this is a person. They are always jealous about their cousins and the brothers. It is like that of the lycopodium. Then isolated feelings. This type of the persons, they always feel themselves alone. The person who are very selfish, they never find any friends in the family or in the surroundings. They are always feel that they are alone. They have come alone in this world, so isolated from others, and they are slow and perfectionist. Confusion is there, and this is the Medorhinum here. Extreme extroversions or introversions. As I told you, the two ends. They may be the self-talking. They may be extroverted type of the person. Then desire to delve into the unknown. This is another important thing. They always want to go. What is the reality? What is the spirituality? What is the unconscious? They always try to find out things which is beyond, not in the present, but in the future. So this is delve into the unknown, thinking about the future, thinking about that something what is there on the planet, other planet. So they are delve into the unknown things. And early sexuality, children that masturbate frequently, frequent erections, little boys dress and girls dress as girls, and girls wear the tightest clothes. So they want to expose themselves for the sexual attractions, and they experiment with the drugs, and that alters their mental states. Then they are always hurry. I told you, time passes too slow, and always rushing on an anticipating yet without any concrete cause and lacking the desire of realizations. Then fear of far off, too far. Confusion as to his identity. Everything seems to be unreal. Delusion is doomed. All real to the effort to escape, and their clairvoyance, idea, forecast. है They are like the astrologer type of astrology. They say that this is going to happen. This is going to happen. So very clear about the future, about the things which is not there. Then contrasting extreme or in one person. Passionate, they are very passionate persons, maniacal, wild, strong sex drive, lack of self-control, cruel and impatient. Then self-centered, it's important. Then procrastinate personality or desire to procrastinate. Procrastination is important thing. They always try to blame others, reproach each other. Son's responsibility. They will not take, they will always, they don't try to take the responsibility. They avoid taking responsibility. Then exceeding all limits, no boundaries due to lack of orientation. So they don't have the future, they don't have the aim. They are aimless type of the persons who have not fixed goal in their life. Then extreme in its pathology. All pathology are very extreme, physical, mental, and intellectual, incapable of maintaining a neutral, stable state. And extreme in its pathology. Happiness, gloominess. I'm just giving you the idea. Introspective, self-accusative, reproaches others, anticipate death, is sure that she is going to speak about it. Fear of darkness, but avoid the onset of the darkness. Hot patient, but death sensitive to the cold air also. So these are the extreme things for us. Then very talkative, sometimes they are very timid and less communicative. Weakness of memory, they are absent-minded. Then everything done is in a great sense desire to procrastinate. And then cruelty to animals, and then extreme food. They love their dogs, they love their pets, trembling all over. Now, this is the important things that this is the end stage where now the things is going to lose. So this is trembling all over. Weeping when telling her symptoms due to the confusion. They are not able to say. So start weeping, start crying. Then fear of the dark, delusion, someone is behind her, fear that someone is behind her. Then biting nails. Why you may see the children to be biting? Because they are curious, they are thinking, they are planning. So always mind is planning. The physical and by biting nails, people used to try to cooperate their mind with the hand. cooperating the mind with the hand. This is the theme for the biting nails. And they crave for the fresh air, can be chilly or warm, tends to warm-sided, it is told for medicine. And I told you that amulate in the evening, night people, they are night type of the people, and discharges, all types of the discharges amulate, the gonorrhea, the diarrhea, menstruation, perspiration, all types of the things that is coming out from the body, vomiting, fishy odor of all discharges. All the discharges which comes out, the smell is like of the rotten fish. Then strong desire to be different things like sweet and sour, not sweet, but sweet and sour, spicy and salt, or everything mixed together, indistinct. And they are better at the seaside. Then knee elbow position. This is the knee elbow position. People used to have it, and then lying on abdomen average. Then early masturbations, I have already spoken about it. And then personal or family history of the gonorrhea. Then dwarfish children, slow learning to talk, children that continue to crawl, fear of dark, very insecure, always keep a toy close to them, very thirsty, asthma, biting nails. The children is very sensitive and emotional, loves flower, beauty, and take good care of them. The child who are polite, soft, passionate, and lovable turn into a devil. He feels a strong desire to bite, kick, hit. So see the opposite things that is there. He is rude and aggressive. All his actions become erratic. He develops inner hardness, which is very deep, and that is why it is difficult, very difficult to handle with children. These children love with wherever is forbidden. Now, you say the child, don't do that, he will do that. And so this is the things that, so they are very tarantula type of the patient, moving like here and there, and courageous, brave. He will spend on himself on being asked that details. You ask about the money, you have to ask about relatives, he will give the details. If you point at the chocolate mark about it, then he will give you the explanations. That no, suppose you say that you have not washed your mouth, he will give explanation. So always trying to justify themselves. This is the he never admits the truth. They only try. Even if they have made a mistake, they will try to justify that they have not made mistake. So some particular symptoms that you can see in this patient: chronic recurrent infections of vagina or bladder, then oversensitive to of the sole and of the feet, always very heat or always very cold, constant clearing the throats every time he begins to speak, almost a specific in Reuter syndrome, urethritis, conjunctivitis, and arthritis, coldness of the breath, coldness of the breast, especially of the nipples, rest of the body are warm. This is another important thing that you can mark. The rest of the part of the body is very warm, but and especially during the mens, and but the breast and nipples are very cold. Crippled nails. The nails are crippled. Then burning hands and feet wants to uncover. Asthma only relieved by lying on the abdomen and sticking out of the tongue. The predominant mental retardations, the mind which is not active, not proper, not clarity of the mind is there. That is called the mental retardations. Growth, mental development is arrested. The intellectual property are getting arrested. So they are physically weak, enlarged lymphatic glands, catches infections easily. The infections can act as a shock to them and may have long-lasting effects at the mental level. There could be shock or some act of the parents, like the parents who are very dominating, like the parents who are neglecting them, like the parents who are fighting among themselves. These are the things that they are they can suffer from that. So withdrawal and hardness can lead to three things. They become now hardness, withdrawal, or support. So three things that you can. They become excessively religious and start feeling that life is unreal. They develop anxiety. They develop suicidal tendency. So constitution, maltreated, suppressed gonorrhea, when the best indicated medicines fails, and for the person suffering from gout, rheumatism, neuralgia, and disease of spinal cords and Medorhinum, and its membrane, even the organic lesions ending in paralysis, which can be traced with the psychotic body. Then serious carcinoma, acute or chronic development with the history of psychosis. Here, the same relation of deep-seated psychotic chronic affections of the spinal and sympathetic nervous system, that Suriname that does with the deep-seated affections to the chronic. So Suriname is on the skin and mucous membrane, but Medorhinum is the affection of the spine, sympathetic nervous system. Children are pale, rhetitis, dwarfed, and stunted in growth, mentally dull and weak, and they have the face cancer. Degeneration sets in early stage. They lose their memory. This is the degeneration. Words, even to the name of their close friend, name of the books. They begin the sentence and halfway, and they forget to complete it. So this part of the body are very sensitive for them: mind, nerve, mucous membrane, lymphatics, cellular tissue, lungs, pelvis, and joints, spine, kidney, and the left cox. So these are the sphere of the actions I have already mentioned. Modalities. They are worse. Cold and daytime 3 to a.m. After urinating, catch, closed room, thinking of disease, heat, sun, thunderstorms, least movement, perspiration, stretching, learning leaning head forward, and salt bath. Better by lying on abdomen, bending backward, and then fresh air, uncovering, hard rubbing, seaside, dampness, and sunsets. It is a predominantly a hot remedy, but they always try to find out the cold places. Child rolls out of the bed in search of the cold spots. They do not like their feet covered. Uncovering ameliorates desire for AC, fast fan, and gets aggravated in the sun. They also have craving for the ice and cold drinks. They get easily exhausted both at mental and physical plane. And these are the things that you don't like: cold drinks, cold food, and eggplants and sweets. Then that eggplants or they desire the alcohol, stimulating things. And there is a great desire for the onion, potato, orange, smoking, warm, and thermals. They are hot peppers with localized cold spots. And hot peppers with localized cold spots. Like the cold breast, cold leg in sciatica, and cold feeling in the lumbar. Miasma is psychosis, diathesis, rheumatic, and goutic diathesis. Adaptability, they are adapted to the phlegmatic temperament, useful for constitution affected, maltreated, and suppressed gonorrhea. Then from the person suffering from gout represent rheumatism, neuralgia, and diseases of the spines. For women in the chronic arthritis, self-anxiety, uh, all these things are the internal. So suitability, the obsessive compulsive patterns, schizophrenic type, all mental type of the disorders, they are included under this. So nuclear summary of this medicine is hurry and anticipation, as if everything extremes, emulated in the evening and lying on abdomen, emulated at the seaside, craving for fresh air, chronic or recurrent pelvic disease, especially after personal or family history of suppressed gonorrhea, and clothing for all sorts of the food. So the people who love eating, the people who are love the modernity, people who love the modernity and who are very much excited for that. So this is the Burnett remarks. My indications for clinic are roused in the small hour of the morning by pain, acidity, coated tongue, filthy taste and breath, uncleanably dirty tongue, weakness, pallor, chilliness, worse from cold wet and moveable clean. It is largely the left-sided remedy. Clean wipes out the half of the case of sciatica that passes my way. What a record! And James Tyler Kane, one of the many use of this remedy is in the inherited complaints of the children. The physicians of long and active experience meet many obstinate cases in the children. The infant soon emaciate and become marasmic, or the child become asthmatic, suffer with vicious character that are nose or eyelids, or has ringworm and the scalp on the face is dropped, and after some rest of the time it comes to mind that the father was treated by the gonorrhea and now it is medicine is required. And then NAS had a wonderful experience. Gonorrheal virus is undoubtedly a great remedy. Anyone who had to do with the gonorrhea will know the severe form of rheumatism, uh, which is which is often the consequence of the introduction of this disease produced into the system. I have seen some remarkable results from the use of this remedy in chronic form of the rheumatism. And then Swan, obstinate cat of he is telling you about the case of the rheumatism, where it was due to the latent gonorrhea, where it was treated with the Medorhinum and the patient got cured. And then Dr. Ellen's, in his Metria Medica, there is a beautiful book by Nosodes, by Ellen on the Metria Medica of the Nosodes. Many of the of where he has talked about that, like every other Nosodes, it should be prescribed according to the strict indications, just as we prescribe arsenic, opium, sulfur, etc. And from our own country, the Shankar Raghunath Pathak. You might have heard of Dr. S.R. Pathak's repertory and Pathak Vestalika. This nosode is prepared from the gonorrheal dysbiosis, a powerful deep-acting medicine indicated for chronic ailments due to suppressed gonorrhea. It affects the mind, nerves, mucous membrane. It is useful for chronic pelvic disorders of women, for dwarfism and stunted sour smolic children, profuse acrid discharges causing itching, disorder of the secretions, offensive order of the body, especially of children and the women, and poor reactions due to them. All these symptoms that I have narrated earlier, they are the remarks and they have been well understood by many of our stalwarts in of the past. So, with these thoughts on the magma and Medorhinum and the hypothesis. This is the things that I tell you that this medicine is the medicines for the civilizations. So thank you very much for this patiently listening. I hope I have tried to express my vision with you, and it may be useful. But try to keep learning. It is not a one-time study. Every time you study Medica, and even this Medorhinum, you can find something new added to your mind. It is only that you have to keep yourself freshen with the medicines by learning and developing the habit for learning and reading Medica organ and the base of your life, the part of your life. So thank you very much for today's listening. And with this, our session is closed. Thank you very much.